Mr. Maso Fukasawa became the mayor in 1957. He addressed three major challenges: heavy snow, poverty, and public health issues. His three reforms began with removing snow by a bulldozer. First, he cleared the roads of snow to clear traffic. Second, he achieved free medical care. The village covered the medical expenses and made it easy for anyone to go to the hospital. Third, he improved the community healthcare services along with free medical care. This video shows collaborative efforts made by community people and medical and health professionals, such as public health nurses and doctors, with the backup support of the local government and a hospital. Sawauchi village is in the east of Iwate Prefecture. Its location is one of the snowiest regions in Japan. The village is surrounded by high mountains, and it is covered with deep snow during winter. Sawauchi also had a high infant mortality rate. How did it achieve a zero infant mortality rate? It was in 1960 when medical doctor Kunio Kato was assigned to Sawauchi village for 1 month. The village did not have any MD at that time. They relied on an ad hoc system to have a physician dispatched from university hospitals temporarily. Dr. Kato was one of such doctors. He played a central role in planning reforms and improving the health programs in Sawauchi. His work began by collecting basic data in cooperation with public health nurses.
We took rough roads for home visit. Sometimes roads were muddy and we got stuck. It took me 3-4 hours to go just 1 kilometer. I only found that the patient with hematemesis was already dead. I thought the situation was abnormal. Severe natural conditions stood in the way of medical services. There was once a tragic accident that an MD was caught in an avalanche and died. I worked in such a village almost for a month. Then I went to see Mayor Fukasawa before my term was over. I said, "If you want this assignment deal to continue, you must improve the current conditions, otherwise the university hospital would not assign MDs anymore." I also requested to improve the hospital. The village hospital had neither a clinical lab nor a lab technician, which were necessary for proper diagnosis. He requested me to formulate a new plan for medical care, healthcare, and welfare immediately. I told him that I could not because I had another assignment, but he kept insisting. We settled to have a 3-month extension, but 3 months were not enough for completing all 3 plans. A total of 15 years passed so quickly. I started formulating the plan. Then I found there were no data available at that time. So we created a healthcare study group to collect essential data. The project finally started, but without a person in charge of drafting the plan. Mr. Fukasawa clearly stated at the very beginning that he entrusted me for all the technical issues. Therefore, I became responsible for this project. I used my dissertation.
The Sawauchi healthcare plan was based on many materials, including Dr. Kato's dissertation titled Surrounding Dimension and Life of Mankind, Human Environmental System and Its History. In his dissertation, Dr. Kato discussed people's lives from conception to natural death in relation to the living environment and sociocultural values, and he discusses the importance of life, enjoying a sense of purpose in life.
I suggested many ideas based upon my dissertation and reported to the mayor of Kasawa every day. We tried to plan step by step based on our consensus.
Dr. Kato paid a visit to every household. He saw villagers as well as their living environments. He checked what kind of homes they were living in. How were the family structures, or who was the breadwinner doing what, etc. Furthermore, the conditions of the other family members were also included into the basic data. A public health nurse made visits when MD couldn't. They collected information, shared it, and created a database, and made an analysis of the real differences. Then, a healthcare plan was made for each villager.
A public health nurse usually works for the community, while a nurse usually works at a hospital or a clinic. As public health nurses, we went into communities, saw people's lives, and promoted preventative care. What we actually did was more than that. We worked with community health workers, the local government, and the Board of Education. Many professionals cooperated with our activities. We maintained close contact with each other and carried out our activities. We worked very hard to save babies. We regarded children as gifts to us, so we tried to save their lives and ensure their healthy growth. We also worked to prevent the elderly from becoming bedridden. Our focus was infants and children, but we also took care of adults and the elderly to help them stay healthy. We wished all the people would live long lives with good health without mental decline.
In a hospital, as one example, MDs and nurses treat patients in cooperation. The same practice should be applied to the communities. MDs and public health nurses work together to improve community health conditions. The name of public health nurse explains its roles. Public health nurses identify health problems and need in a community and find ways to solve them. Public health nurses have rich experiences and a vision, so we can expect them as supervisors for community health. They gave me any community-related information, including information on babies. It is extremely important to work with a plan while catching information of your community.
The public health nurses conducted solid community health analyses and provided healthcare plans for each household. Next step was to realize the free medical care.
I proposed free medical care and health care. There were many patients in Sawauchi, although they did not come to the hospital. They did not come to see MD in the hospital because they had to pay for the services. Back then, the patients needed to pay 50% of the fee out of pocket. Most of the villagers could not afford 50% payment. So we proposed the village cover the patient's fee with the village budget, but the village could not afford it. The village made the National Health Insurance Scheme cover the patient's out-of-pocket payments. The director of National Health Insurance Department directed to cover them with the National Health Insurance Tax, instead of the National Health Insurance Scheme itself. My suggestion was to cover it with the general finance of the village, but Mr. Fukasawa could not. As a result, 100% of medical fee were covered in the end. The prefectural government was very angry, saying it is violating law and it is illegal. Of course, they were right. Mr. Fukasawa knew that as well, so he came up with his own justification.
Japanese Constitution, Article 25, Right to Life. The article stipulates that all people have the right to their life and the national government should assure it. Mr. Fukasawa brought up this article and said, "I may be violating the law, but I am doing right in light of the Constitution, Article 25. I will carry this project to the end, regardless of what the government officials say." He launched his plan saying that the national government will follow me in the future. In 1960, the free medical care for people aged 65 and older was realized. Next year, it was made available also for infants under 1 and people aged 60 and older. This new system made it easier for many elderly to go to a hospital without financial concerns. The elderly became healthier and advised other family members to go to the hospital. Gradually, the general mood of the entire village became positive. In 1962, Sawauchi achieved a 0 infant mortality rate for the first time as a local government. Their living environment was also improved. Dr. Kato came up with a house design in a heavy snow region since many children suffered from rickets due to the lack of daylight at home. The Health Management Department was set up at the hospital in 1963 to strengthen community health activities. They relocated the department from the village office into the hospital and assigned the director of the hospital to be a director of the department as well. MDs, public health nurses, administration officers, and nutrition officers worked in cooperation there. This was a good system for public health nurses to work together with medical and welfare staff. It was a pioneering system to offer a holistic care, inclusive of healthcare, nursing, preventative care, and so on.
MD Kato had a vision of people living in a community throughout one's life, starting from conception till natural death. A healthcare system should be there for people, offering assistances at each stage of their lives. So a discussion with Mayor Fukasawa led the village to establish the Health Management Department. The establishment of the department was in the year when I first came to Sawauchi. The aim was to enhance people's health, and it was the first health promotion department in a local government administration system in Japan. It was a significant achievement.
In his lecture next year, Mr. Fukasawa mentioned, "A hospital is regarded as where one goes to receive treatment. Its duty looks like only medical treatment. Healthcare is recognized as the prevention of diseases and the promotion of good health. Therefore, medical care and healthcare are recognized as 2 separate systems. It is already wrong in thinking this way. Medical treatment, a hospital, is only one of the many healthcare activities. I don't regard them 2 systems. They are one system. They should be integrated as one health administration. A hospital is a part of health administration institution which provide medical care. It is extremely important to have this vision. A hospital is not only for when one gets sick, but its true responsibility is to guide one not to get sick. The healthcare administration should help a community not to rely on medical institutions."
The Health Management Department was a good thing. I was appointed as the department director. If I am an MD in a hospital, I will be responsible for my patients. It is not my responsibility if things are outside of a hospital. Of course, I will make home visit consultations upon request, and that would be my responsibility. On the other hand, the director of the health management department is responsible for the healthcare services for the entire village. Interestingly, the director begins looking at the hospital in an objective manner. You know what I mean. If you are inside the hospital, you went in to provide good services to the patients who come to the hospital. On the contrary, if you are the director of health management department, you need to think about the roles of the hospitals for entire community. The hospital gradually changed its services. The hospital is the health administration office taking care of the healthcare of the entire community beyond treating patients and gaining profit. It can provide health checks and tests, theoretically. I am pleased to be the director of the health management department and understand the new roles of the hospital for public health. Later on, we started new services, such as health and medical checkups for the community. I believe the establishment of the department was significant, making many contributions to public health.
Our healthcare programs for infants and children went extremely well. We took care of expectant mothers at antenatal checkups, during the deliveries, and after the deliveries, so we got to know each other well. The mother and the baby went home 10 days after delivery. We conducted home visits to them if necessary. We held periodical health checkups for infants and children, which included checkups of mothers and family members. We also conducted health checkups of children for school entrance. School entrance checkups were to screen children with special medical and developmental needs and to provide appropriate support to them at an early stage. A dentist, a pediatrician, a nurse, and a dental hygienist worked together to check children. Public health nurses and a yogo teacher or school health nurse also worked together with the team. A speech therapist and a child development specialist were there too. After finishing a series of checks, we got together with MD Ishikawa to share the information. We discussed and made recommendations about each child and how to support them at school. We consulted the MD for health advice and handed all the information to a yogo teacher, school nurse, from each school. Even after they entered school, we discussed how to assist them with MD Ishikawa whenever necessary. We used to go to the community center once a month for health counseling and guidance. We checked blood pressure and conducted health education to the community people. Sometimes we were alone, and sometimes we were with a nutrition officer. The health management department increased the number of dental hygienists gradually. Our staff were with public health nurses, midwives, nutrition officers, dental hygienists, as well as the administration staff and drivers. Everyone worked closely together to provide the public services to the community. We visited the community center with a nutrition officer or a dental hygienist. While we, public health nurses, checked the blood pressure of the community people, the nutrition officer or a dental hygienist conducted health education to the people at the waiting line. We planned an efficient way to use people's time by giving relative guidance in their spare time. Following the health education, we also conducted cooking demonstrations and provided some recipes. It was an opportunity for us to provide a wide range of information. We, public health nurses, usually conducted home visits after the event. We visited the ones who did not participate in the event and for whom we were concerned about their health conditions. We checked if someone stayed in bed or had some challenges or troubles. Community support was necessary for us to conduct home visits. The public health nurses divided their communities in charge, as well as their work in charge. Each public health nurse had her tasks separately, but all of us understood the conditions of the entire village. It is like a network. If someone moved into the village with a child, we collected relevant information, such as whether she is a student or vaccinated. We looked around the village and tried to support the life of all villagers. If something was missing, then we tried to find a way around it. MD Masuda was the director of the department, so we felt at ease to consult with him when necessary. It was a good working environment.
Health is a driving force for the search of one's happiness, so it should be protected. Healthy birth, healthy growth, healthy aging. It was important to provide the latest and the most advanced comprehensive medical services based on the latest academic advances. It was also important to ensure the healthy and cultured living for all. The concept of public health in Sawauchi village looks similar to the concept of universal health coverage. Universal health coverage, UHC, means that all people have access to the full range of quality health services they need when and where they need them without financial hardship. The strategies taken to achieve healthy lives in Sawauchi village are very similar to the strategies taken to achieve the UHC in the world today. To achieve UHC, we must overcome 3 barriers: physical, financial, and sociocultural barriers to ensure the access to the services. It is also important to ensure the quality of care in service provision. Removal of heavy snow was for the reduction of physical barriers. Free medical care was for the financial barriers, and the public health activities were for cultural barriers. Even from a modern perspective, Sawauchi village's reforms were quite advanced.
I said that it was good to set up the health management department earlier. I do not like the word health management, though. The word has a bad implication. At worst, it would turn into human management. Nowadays, medical care has become like a human management with data to some degrees, possibly due to the scientific advancement. Education and welfare are also becoming something like so. It is important to interact and talk to patients to manage their health, not patients themselves. Discussions and dialogues are essential. In Sawauchi, we had frequent meetings of healthcare committee and discussed various issues. A top-down approach isn't good at all, only creating a stressful environment for everyone. Therefore, MDs, public health nurses, and welfare staff should avoid top-down human management. They should be working for people with people. I would like all of them to be good supporters. They should support community people, patients, and people with disabilities, not to manage them. This perspective will change attitudes of personnel and bring them more joy in return. You will not feel happiness through simply managing something. You can feel joy and happiness through sharing time and feelings with people you support. I hope that they will find a sense of joy and happiness out of such experiences.
At nursing school, we learned the roles of public health nurses. Our duty as public health officers at the local government is to protect and promote the health of all the people in the jurisdiction areas, based upon Article 25 of the Japanese Constitution. Public health nurses take care of the prevention of illness, which includes the risk factors in the environment. I know many senior nurses who actively worked in the field of pollution control. They had a bigger scope of responsibility. It seems to me that the current preventive care education focuses more on clinical issues rather than the environmental issues. I want to highlight the importance of the environmental factors for the prevention of illness. We must look at people's living conditions, work environment, and community environment. One's health condition is created by the surrounding environment, including family and community, food, and all that involves the person. That is why public health activities should be conducted by the local government. Home visits are extremely important because we can realize many things through those visits. Such information is not available over the phone, so we see people in the community. We try to find some hints in the community. It is a very important job for someone who works in a local government office or a community health center. It is also an important job for public health nurses. I hope the young public health nurses work in a community-oriented manner and study community people closely. It will be great if they can feel a sense of responsibility for doing so. I feel the same with the staff at welfare facilities. I hope they will support their people with preventive measures. The prevention of illness leads to the prevention of nursing care among the elderly. I really hope they understand it. I hope that they promote healthy lifestyles and that they find it joyful. The roles of public health nurses may differ by location, such as in urban areas, or suburban areas, such as in Sawauchi village. Another may work in a coastal area. Their work is influenced by their surroundings. However, the feelings of the people they work with may be the same. It is necessary for us to work for people with passion. Newly recruited public health nurses have a good academic knowledge about their job, but they may have to face many real issues which were not covered in the textbook. They need to consider a wide range of hints to find solutions for those real issues. They should work together with other staff to find solutions. This is teamwork. I was lucky to work in Sawauchi because the health management department was located inside the hospital and the department and the hospital were coordinated well. The activities of the Board of Education and the Social Welfare Council were also coordinated well. This close coordination really supported us to work as a team. We always shared information and held meetings periodically. We reviewed the healthcare plan once a year. Many different professionals got together to review the plan for the villagers. It was essential for them to cooperate and consolidate the plan. I was very grateful for this coordination to share the information and work according to the plan. I felt this coordination helped our work go smoothly. Public health nurses also need to have passion in their work. We sometimes went to see a mother and a newborn in a heavy snowstorm. We were committed so much to saving the mother and the baby and did not listen to others who advised us not to go. We came back safely, so it was a relief. We were so committed to saving the lives of the village people. That was a sense of responsibility. Sharing information and having a common understanding was very important. We helped each other many times. Our network and communication among the public health nurses and other staff were very important. I felt people in the village were part of my family. They talked to me very casually, and I did the same to them. I had lots of fun.
One of the reasons that Sawauchi achieved the 0 infant mortality rate was to have local people involved. The village openly promoted women's activities. The class for young mothers was conducted to educate mothers or mothers-to-be to protect their children. In Sawauchi at the time, some grandmothers looked after their grandchildren while mothers were working. So the village recognized their contributions to grandmothers by issuing an Honorable Grandmother Certificate. The village also had a tradition called Yui, bond, that people helped each other. The idea was to help each other to live comfortably, even in a difficult natural condition. Such actions were made voluntarily. This tradition worked well to promote the holistic healthcare. The Sawauchi village has been merged with Yuda town to become Nishiwaga town. It became a new town with additional citizens and a new system. But the Yui spirit is still there, making contributions to today's public health promotion.
Ms. Hisako Fukasawa was the chief public health nurse when I was newly recruited. At her retirement, she said something that has stayed in my mind ever since. I learned a lot from the community at work. Now I am retiring and wanting to pay it back to them. Her words made perfect sense to me. I thought, I will do the same. I will go around the community and learn from the people. Every day, I feel it is them who are telling me about life, and I am the one who is learning. I feel that I am learning from them rather than I am supporting them.
In Nishiwaga town, which used to be Sawauchi village, the local government and the residents are working together to conduct various public health activities. This senior citizens club, organized by selected leaders, is very active to conduct various programs to maintain the health of its members. The exercise class is conducted with the volunteer instructors at the community. Such instructors are highly self-motivated to realize the healthy community. It is a synergistic system to lead everyone in the community to be healthy.
It is a challenge to make members motivated. It is no good if they think, the same program again. If they find it fun or helpful, they will come. They may share their ideas and concerns about public health programs as they come. We may take their ideas. Members may feel content as their ideas are accepted. That will improve the trust relationship between residents and the administration. Once the trust relationship is established, the residents may listen to what the government officers say for their health promotion.
Nishiwaka faces emerging public health challenges such as global climate change, low birth rate, depopulation, aging, and infectious disease control. Nishiwaka continues to promote health for all with the integrated efforts of the local government officers and the people in the community. Nishiwaka's past experiences and their current efforts to promote the health of the entire residents with the integrated efforts of the local government and the community will provide significant implications for other countries and local governments which seek the achievement of universal health coverage.